Hello, everyone, and welcome. Happy Monday to all of you. I'm quite sure you're saying, this Robin Shine Maddox, every time I turn around, she is back on doing Facebook Live. Yes, because I want to continue to connect, to empower, to inspire, to offer hope to all of you. So, welcome to our Facebook Live. Folks, let me tell you, I have another guest who's going to be joining us. We're going to have great conversation. And as you know, celebrating sisterhood, She Shines Conference with our three core pillars. You should know them by heart by now. Social justice, that's social justice / voting rights, health and wellness and safety. And then our last is spiritual enrichment. Not necessarily last, but number three, spiritual enrichment. So tonight, we're going to focus on health, wellness, safety. More specifically, I have with us tonight a new friend. His name is Scott Yeager. He is the outreach manager for Pennsylvania Pennie. Now, I don't know if you have ever heard of Pennie before. If not, don't worry about it. We're going to learn about Pennie, and hopefully, prayerfully, many of you will, connect and sign up with Pennie. Well, what is Pennie? Pennie focuses on health insurance. Now, if not you, I do know that you over there, yeah, you who just tuned in, you who've been sitting patiently waiting for us to tune in, you all know somebody, at least one person who is not covered does not have health insurance. Everyone needs health insurance. It doesn't matter how young or how old. You need health insurance. So what we're doing tonight, we're going to bring to you information and connect you to Pennsylvania Pennie Health Insurance. We have great information, a lot of information to cover in this time. So without further ado, I want to welcome Scott Yeager from PA Pennie Health Insurance. Woo! Do you hear the claps? Do you hear the claps? Woo, woo. Hi,
Robin,
Scott.
I can't thank you enough. This is fantastic, and thank you so much, everyone, for the privilege of your time this evening. As Robin mentioned, um, we're a relatively new state agency here in Pennsylvania. I can provide you with some information that can not only help you get protected, but to help you protect your friends, your neighbors, the people you care about most, especially when they, uh, especially when they utter the words, "I don't have insurance," or more commonly. Through 2021, 2022, we've had a lot of our friends and neighbors utter the words, "I lost my insurance. So now what do I do?" Um, Robin, before I dive into things, I just wanted to check back with you. Is there anything that you'd like me to mention before we get started?
Oh, well, look, I have like 100 questions. Do you see?
Oh, okay. Well, if you have questions, I hope I have answers. And here's the thing, anyone who knows me knows that I make absolutely no declaration that my thoughts or ideas have their origin in the mind of greatness. However, I do know more than most when it comes to health insurance and Pennsylvania's official exchange. I most definitely can. I'll make sure I get my contact information in the chat for everyone. But Robin, if you'd like, let's go ahead and get started. I've got a lot of good information to share.
Yeah, so let's get this party started. Okay. So, Scott, first, could you just give us a brief overview about Pennie, how it came about, the services offered? Also, I know this is a lot and I can repeat it. Compare and contrast the difference between Pennie and other health insurance providers. And of course, a lot of people want to know, is this income based? Is it only for individuals, families with a certain a certain income? So let's start with the overview of. Tell us a
Okay.
little bit more about Pennie, how it got started.
All right. Well, Robin, I will be brief on this, but we all need to take a step back a few years to a very, very different time. And that very different time, it's not all that long ago, but it seems like a long time ago. And that's 2018. Okay.
Mm,
Um, in 2018, the Commonwealth of Pennsylvania was the official marketplace, the health insurance marketplace. And I guess that's where I'll start with the definition of penny, because
mhm,
a lot of people they're confused because there are a lot of choices in Pennsylvania, and we'll talk a little bit about that here in a minute and why that's
mhm.
a good thing. It's not a bad thing.
Okay.
But you'll hear people talk about medical assistance, Medicare, veterans benefits,
Mm,
employer sponsored coverage. You'll hear people talk about, healthcare.gov, things like that. Um, what Penny is we are a marketplace. Okay. In fact, in 2018, the Commonwealth of Pennsylvania was sending about $98 million a year back to the federal government for the use of healthcare.gov as a platform. There were a lot of really forward thinking legislators and policymakers, many of which, uh, came from southeastern Pennsylvania to Harrisburg and said, you know what, we can do this better. So what they did is they created Penny. And if you're wondering where our name comes from, it's PENN. It's Pennsylvania. I is for insurance. E is for exchange. We are a marketplace in Pennsylvania. We're not an insurance program. We're not medical assistance. We're not Medicare. We're a marketplace. Now, what's unique about that is that through our legislation, which, by the way, passed unanimously
mm.
bipartisanly through both chambers of the Pennsylvania General Assembly. If you think that's akin to a blue moon, yeah, it is. So, um, long story short, Penny was signed into law as a new health insurance exchange for Pennsylvania residents in 2019, July 2nd of 2019 to be exact. Um, Flash forward to November 1st of 2020, and Penny actually launched as the official state-based marketplace here in Pennsylvania. Now, in that process, we accomplished a lot. Number one, we saved, as an agency, we saved the Commonwealth of Pennsylvania millions. Secondly, we were able to establish local control of Pennsylvania's health insurance marketplace. What does that mean? In short, what that means is that through the pandemic,
Mm-hmm.
uh, we were able to do a lot of really cool things. Like we established a unique open enrollment specific to those who were impacted by COVID-19. We're
Wow.
in a position where we've been able to respond to individuals that may be in a gray area. And
Okay.
what I mean by that, and we'll talk a little bit more about gray areas because there are a
Mm-hmm.
lot of our friends and neighbors who are caught in those areas where they scratch their head and they say, I don't know what my insurance options are. I don't know if I'm a person starting a small business, can I, if
Wow.
it's just me, can I access
Mm-hmm.
health insurance through Pennsylvania's marketplace, or do I have to wait until I get 3 or 4 employees so that we get covered under group? There's a whole host of things that we can explore, but to the point, what what really has made Penny a unique force here in Pennsylvania is yes, we're new. A lot of people are still learning who we are, but we do a few things that are very, very important for individual health insurance here in Pennsylvania. Number one, we set up a reinsurance program that helps regulate. It acts a lot like the thermostat on the wall in your house.
Mm-hmm.
It helps regulate the rates and premiums in the individual health insurance market.
Okay.
Point of fact, You can have the best health insurance on the planet and the best plan options available. But if people can't afford them, you've got a boat on dry land. And
Mm.
that is a full stop right there.
Mm.
Most people, the most significant barrier that they have to acquiring health or dental insurance is real simple. Can I afford it? Well, the good news about Penny is, in addition to our reinsurance program, we also set up a competitive marketplace here in the Commonwealth of Pennsylvania. In 2018, under the federal marketplace, if you were, and I'm just using this as an example, excuse me, if you were in Philadelphia, you may have had one insurance carrier providing multiple plan options.
Mm-hmm.
But let's face it, Robin, one is not a choice.
Hmm.
So now, under Penny, we have created a competitive marketplace. And in that competitive marketplace, I am very, very happy to say that in all 67 counties of Pennsylvania, we have at least two health insurance carriers with multiple plan options
Mm-hmm.
available to the residents of those markets. In Philadelphia, Chester, Montgomery, Delaware, Bucks, we have four.
Mm-hmm.
Four
Okay.
insurance carriers with multiple plan options. That's choice, and choice matters to
Matters.
consumers. All right. So that's number two, reinsurance, competitive marketplace. But most importantly, what distinguishes Penny as a marketplace
Mm-hmm.
from medical assistance or Medicare or employer sponsored coverage, et cetera? What makes us different is we provide financial assistance. And where does that come into play? It comes into play in helping someone who might be between jobs, or someone who just gained lawfully present status here on a worker visa, student visa,
Mm-hmm.
etc., or helping someone who was recently released from incarceration. Answer the question, I don't qualify for medical assistance. I'm not old enough yet to age in to
Right.
Medicare and Medicare options. I don't have access to insurance through my employer. What do I do? I need it. I know I need it. Why do people know that they need health insurance? They know they need health insurance because the number one reason in this country and within the Commonwealth of Pennsylvania that most people declare bankruptcy is because they cannot manage their medical bills, their medical expenses. And that is why Penny is here to help. That's how our financial assistance can take an individual from, what do you, I can't afford that, to, hey, I can afford that. 14%, 14% of the 374,000 customers that we have here at Penny, 14% pay less than $1 a month for their health insurance. So are we in a position to help the uninsured get protected? Yes. And I'm going to take 2 seconds to talk a little bit about the uninsured because it's important.
Yes.
Within the Commonwealth of Pennsylvania, right now,
Mm-hmm.
there are 607,000 uninsured. That's a lot of people, a lot of our friends and neighbors, 1 in 20 to be exact. Now, if we pare that down to Philadelphia, a lot of folks, I'm not a sports guy, but a lot of folks like sports. If you take Eagles Stadium,
Mm-hmm.
hold, holds roughly 73,000 uninsured. We would still, if we packed to capacity, and in fact, I stand corrected on that. It is 71,896 because I looked it up. if we packed Eagles Stadium, we would still have, once we packed the stadium, we would still have enough uninsured in Philadelphia to stretch from there all the way across Greenwich Yards, all the way into the Delaware. Okay. So let's be generous for a second and say, okay, well, let's pack, the Eagles Stadium, and if you're a hockey fan, let's go ahead and add 19,000
Mm-hmm.
over in the stadium for the Flyers.
Mm-hmm.
you'd still have enough to stretch from there
Okay.
all the way down to the shipyards. You would. So, long story short, within that 607,000 uninsured, 1 in 5 of them reside in Philadelphia. 36% of our entire uninsured in Pennsylvania, Philadelphia, Bucks, Chester, Delaware, and Montgomery. 36%. Wow, do we have a lot of work in front of us? And as a new agency, as the new health insurance exchange for Pennsylvania, that's where all of you come in. That's
Hmm.
where that's where putting an ear to the ground and listening to your family, listening to your friends, your neighbors when they're in those gray areas that I mentioned before, those times of transition, when they think they don't have an option. That's where we can help.
So let me recap what you just said, and you said a lot. And oh my goodness, even I, of course, I didn't know all that, right? So that's why I reached out to you and said, hey, not being
Yeah.
selfish and just educate me. I'm gonna bring some folks along so you can just educate, folks who I'm connected to, or some way, fashion, or form. So
Right.
let me get this straight. So 607,000 folks right now
Yes.
are uninsured.
Uninsured. And that's without health insurance.
Right.
Again, if we were to talk about auto insurance and things like that, I think in Pennsylvania it's somewhere to the tune of 1 in 14 don't have auto insurance. But for
But
health
no, we're
insurance
talking about health.
purposes,
Let's be very clear. We're talking about health insurance, right?
yeah,
And 1 in 5 are in Philadelphia.
correct,
So if I'm
correct.
sitting on a bus, on a SEPTA bus, I'll just count 1, 2, 3, 4, 5. Oh, 1, 2, 3, 4, 5, or a crowded train, right?
Yeah,
Wow.
that's a
I
lot of
see.
people.
That's a whole lot of people who are uninsured. And
Right.
I mean, go, I can go, well, there's so many things that's right now coming to mind.
Yeah.
When we think about the number of folks, and just here in Philadelphia, right? We're
Hmm.
not even talking Pennsylvania
No.
or surrounding counties. We're just saying right here in Philadelphia. And then, now that you shared and informed many of us, right? That Pennie, well, let me, before I go there, let me tell you, thank you for sharing how you guys came up with the name Pennie.
Yeah.
I thought, don't laugh, I'm gonna put myself out there, but it's okay. I'm like, Pennie. So I interpret that to me, health insurance is really, you know, um, low cost. I mean, people don't have to spend a lot for a health insurance, and that's why they call it like maybe Pennie. I had no idea that it stood for Pennsylvania Insurance, right? I'm missing it.
Exchange. Yeah.
Exchange.
Pennsylvania,
That is
Pennsylvania
so
insurance.
creative,
Yeah.
Pennie.
Well, yeah, but here's the thing. Here's the thing. And again, this goes back, Robin, to the greatest barrier that most people have if they don't have access to health insurance through work, if they don't qualify for medical assistance, if they're not old enough yet for Medicare and Medicare options, if they don't have access after service to veterans benefits, health insurance is expensive. And I'll be the first one to say it is not cheap. However, when you weigh the cost of health insurance over the decades that it would take someone to literally dig themselves out of bankruptcy because they were unprotected. Um, I'm glad that there's sort of a secondary connotation to our agency's acronym. And our official name is the Pennsylvania Health Insurance Exchange Authority. If you say that 3 or 4 times real fast, your jaw's going to cramp. But Pennie, we are here to help make individual health dental insurance, health insurance options for individuals, for families, for small business owners, for those who are lawfully present, etc. We're here to help make that pathway affordable.
Well,
And we do that through, like I said, our reinsurance program, through a competitive marketplace, and
excuse
bless your heart. And more importantly, we do it by way of financial assistance. And that is, um, that truly is what I'm glad to say makes Penny very different from going directly, because all Pennsylvanians, if they don't have access to health insurance through work, if they don't have access to medical assistance, Medicare, etc., there is an independent and an individual health insurance market here in Pennsylvania.
me.
But you have two options there. You have marketplace coverage, which guarantees certain things.
Hmm.
There are 10 essential health benefits that are set forth by the Affordable Care Act that
Hmm.
are literally baked in
Okay.
to all of our plans here at Penny and all of our plan options. Things like emergency care, prescription medications, maternity, newborn care, substance abuse, mental health, outpatient care, etc. But here's the cool thing about Penny as a marketplace: no one can be denied because of a pre-existing condition. Now,
I was.
if you think about any of our friends and neighbors right now who are experiencing a loss of a job and they're in between employers,
Mhm.
think about this scenario. Think about that person. And on another level, think about their dependents that
Mm.
may need to see certain physicians, certain hospitals, have certain prescription medications available to them. Um, it means a lot to be able to have options where you're not going to be denied because of a pre-existing condition. Your insurance premiums are not going to get jacked up through the roof because of a pre-existing condition. Well, that's the marketplace. That's Penny. Now, you also have off-market options in Pennsylvania, which again, options are good.
Hmm.
And we want everybody to know all the options. Options are good. There is no saying. In fact, it's a simple goal of Penny. We want people to get protected. Um, how you get protected is entirely up to you because you're the customer, you're the individual in the driver's seat. If you go directly to an insurance carrier and shop your plan options with them, fantastic. The idea is get protected.
Right.
So, Penny's here. Where we tend to differ from other marketplaces is we can provide financial assistance, and that goes a long way.
Wow. So, you had mentioned earlier, um, several of the various populations that Penny will cover,
Mhm.
and you mentioned even those who are um, re-entering back into society, those who were
Yes.
incarcerated.
Yep.
So for those who are coming out of prison,
Yep.
or
Oh, it's prison, it's jail or prison.
right.
Okay.
Yeah.
Being released from incarceration any time of year is a qualifying life event at Penny. Okay.
Okay.
Now, granted, um, there are a lot of individuals that might qualify
Mm-hmm.
for medical assistance,
Mm-hmm.
but for those who don't,
Mm-hmm.
what a position to be in,
Yeah.
where it's like, okay, I literally just got released. I've re-entered society. I'm different. The world's different now, and I don't qualify for medical assistance. What do I do? How do I
Mm-hmm.
protect myself? How do I protect my family? Again, you can send them to Penny because that is something that we can help with. I saw a question that Ken had over in the chat about when people can get protected. And Pennie's kind of unique in that, yes, every year, November 1st to January 15th, we have an open enrollment period. So this this week is our last week of open enrollment. In fact, our call center at Pennie will be open until 11:59 p.m. on January 15th. I mention the 15th because right now, um, any anyone who is uninsured, who needs to look at health insurance options for 2023, now is the best time to contact Pennie. And it's not just for health insurance. We also have dental insurance here at Pennie. Okay.
I was about to ask, in addition to like health insurance,
Yep.
what other type of services do you guys provide? Well, we know medical health. What about dental?
Yep.
Do you what do you call if a person females have to go see their OBGYN,
Mhm.
any type of screening? So could you just share some of
Sure.
the
Sure, sure.
okay.
Yeah, no, Robin, those are actually really, really good questions because
Mhm.
again, you can have great insurance, but if people can't afford it, you've got a boat on dry land. And if you have insurance that people can afford, the big question is, can I afford to use it? Because on the other side, you've got copays, deductibles, copayments
Right,
for things
right,
that, someday everyone will lose their hair like me. And they, you go into the deep dive on stuff like that. But to your point and to your question, as standalone plans, Pennie offers health insurance and dental insurance, and customers can purchase health or dental. Now, here's a really, really cool development. There are some of our insurance carriers, the insurance companies that sell their products through Pennie, they have comprehensive plans. And what
okay,
do I mean by that? I mean plans that include um, health, dental, adult dental,
mhm,
and vision. Okay.
okay, so
But again, it depends on the plan and
right,
it depends on your type of plan. The one nice thing about our marketplace in Pennsylvania right now is that you, as a customer, are in control in terms of what is right for you, what your needs are, um, and whether you are shopping anonymously through pennie.com, or if you're working with our customer service team, either online through our chat feature or calling 844-844-8040.
okay. You say that again, that
Yeah,
number,
most
Vice
definitely.
Lord? Okay,
Yeah, for individuals that truly want to explore their options anonymously, one of the cool features of Pennie is that you can go to pennie.com,
mm-hmm.
and in pennie.com, um, you can shop anonymously. You're not in a position where when you go to our website, you are required to establish an account.
Okay,
We'll never ask you for that. We won't ask you for personal information like a social security number or your phone number or your email address. Or we provide a platform where anyone, whether you are the individual looking for insurance, someone who is helping someone else
okay,
look
mm-hmm.
for insurance,
Mm-hmm.
we provide you, whether you're on a PC, a tablet, a mobile device, with a platform where you can come in on your own terms. You can shop and compare our plans. And there are three pieces of information we do need. We need a zip code. That helps us figure out where in Pennsylvania you are so that we can present you with the correct health
Right,
insurance companies and products.
mm-hmm.
The second thing is we ask for a date of birth. And I know I know some folks are kind of, they don't like giving out their date of birth, but that is the one, I guess you could say, the one piece of personal data we ask for. But then we also ask for the household income.
Okay.
So
Mhm.
zip code, date of birth, household income. Also, you can, through our comparison shopping tool at Pennie, and again, this is right through pennie.com homepage, right at the very top, you'll see a gold button that says get protected or get
Mhm.
covered. You can click on get covered, boom, you're in. Um, what's so unique about that is that we recognize, Robin, that no person, no one, is born with an inherent knowledge of health insurance.
Right.
It is a complicated topic,
Mhm.
but we've got answers.
Mhm.
We've got help and we've got support.
Mhm.
First layer of support.
Mhm.
Again, 844-844-8040. One call to Pennie's contact center, and you're put in touch with individuals both in English and Spanish,
Mhm.
or for those who might have a primary language other than
Mhm.
English or Spanish, we have a translation service with over
Okay.
240 different languages available that can
Mhm.
help you approach health insurance in your primary language, which
Mhm.
can be a tremendous help. Um, but what's unique about our customer service representatives is they work for the Commonwealth,
Okay.
they work for you, they are unbiased,
Mhm.
and they are not insurance salespeople.
Okay.
Okay. So when when you make a call, they can answer questions, they can help you figure out what you qualify for in terms
Mhm.
of financial assistance,
Mhm.
and ultimately they can help you secure the health or dental plan that's right for you.
I have a
Yeah.
question.
Yeah.
Is the call center, is that 24 hours, 24/7, or is it a certain time that
That's
what is
yeah, Robin, that's a great question. Now, during open enrollment, which we are currently in open enrollment,
Mhm.
our call center is open Monday through Friday, 8 a.m. in the morning until 7 p.m. in the evening.
Okay.
Okay.
Mhm.
On Saturday, on Saturdays, we're open from 8 until 1 p.m.
Okay.
Now, when we get outside of open enrollment, and that's a whole other discussion because a lot of people think that the marketplace goes away when open enrollment closes. Oh, my friend, I am here to tell you, we've got a lot of good information for folks
Okay.
outside of open enrollment here in Pennsylvania.
I'm
Uh,
glad you said that. Excuse me. I'm glad you said that because I was about to ask you the question.
yeah.
Like, once, January 15th,
Yep.
no, 14th at 11:59, right? Then
Yep.
what happens? You know,
Well, here's the thing, and that's an incredibly good question, Robin, because like I said, a lot of folks they have this misconception that, oh, I missed open enrollment.
right.
Oh well. No, no. Through Pennsylvania's marketplace,
Mhm.
we have what's known as a special enrollment period. January 1 every year to December 31 every year. Special enrollment. Now, what do we need to qualify for special enrollment? Well, you need a qualifying life event. What's a qualifying life event? Really, really simple things: getting married, getting divorced, having a baby, adopting a child, being released from jail or prison any time of year, gaining lawfully present status, student visa, worker visa, on a path to citizenship. You can also change zip code within Pennsylvania.
Oh,
Example, let's say I live in Erie, Pennsylvania, and I get a job offer in Philadelphia.
mhm.
Well, if I relocate from Erie to
That's
Philadelphia, that's an entirely different health insurance market than Erie. So
mhm.
now I have a qualifying life event. Also, there are other more common things like I just got a notification from medical assistants that I just lost my medical assistance. Now what do I do? Call Pennie. I just lost my job and my employer sponsored coverage. Now what do I do? Call Pennie. I just got this Cobra letter, and whoo, trust me, anyone who's ever gotten a Cobra letter, wow, is employer sponsored coverage expensive? Generally, after they're waved off of the ground with smelling salts, they're looking for options. Pennie is an option for those individuals.
Mm-hmm.
And also, I did everything right. I worked hard, I saved my money, I retired a couple years early, but I don't qualify for
Mm-hmm.
medical assistance. I don't qualify for Medicare or Medicare options because
Mm-hmm.
I'm not old enough yet.
Right.
What do I do? Come on down. As you and I sit here right now, 36% of Pennie's current customers are individuals and couples who are in
Yeah.
that 55 plus category. Um, we're helping a lot of people save a lot of money. So that's why I think it's important to talk about the fact that we don't go away when open enrollment closes. Options are here. And when people fall into those gray areas where they wring their hands and say, I can't afford it, I know I need it, but I don't know what my options are. There's a new option here in Pennsylvania.
Here's a question that
Hmm.
came up. Is it mandatory
Hmm.
for all Pennsylvanians to have health insurance?
No, no. That legislation recently changed.
Okay.
It's not, but here's the thing, and granted, at one point in time, it was the law. Yeah, you wanted to make sure you had health insurance or you faced a tax penalty.
Right.
Well, but here's the thing. Here's the thing. Think about that. Yeah, we're in a situation right now where it's no longer required by law. But if you remember what I said not too long ago, the number one reason people declare bankruptcy
Speak.
in this country and in our state is because they don't have the protection that health insurance affords them.
Mhm.
Um, I guess you know, in my small corner of the world, I always beg the question, is it better for me to be protected than not? Or should I be in a position where, even if it's going to be a little tough for me, should I roll the dice and maybe wind up going from frying pan to fire? And if your luck is anything like mine, it's generally frying pan to fire. So it's oh,
Well, I two another. Well, I have a couple more questions, but so that's this is great. Wealth of information. I can't even put a price tag on this one, right? It's priceless, right?
well,
Um, and does Penny cover? I know you said emergency care, but what
yep.
about now? We see a lot of urgent care.
Mhm.
The facilities, around now. Will Penny cover um, emergency care? I mean, urgent care
Yep.
visits. You mentioned emergency care visits. And if so, is there a cap? Is there a limitation throughout the year when if a person has to be rushed to an emergency? Like, I don't, is there a cap to it or,
Yep.
you
Well,
know,
here's the thing, and I'll start with the very last question. Is there a cap? There are no caps on the plans and benefits that we have here at Penny. Okay.
okay.
Now, what I will say is this: Penny has a number of different health insurance carriers that all
Mhm.
provide different options.
Okay.
And under each of those options, you're going to find, different levels
Mhm.
of coverage for emergency services,
Okay.
for doctor's visits,
Okay.
in terms of copays, in terms of
Mhm.
deductibles, things like that.
Okay.
Um, but here's the interesting thing. Um, a lot of the health insurance plans that we
Mhm.
have a separate uh, deductible
Mhm.
for emergency care, unless you're admitted, in which
Right.
case, that deductible,
Okay.
let's say it's $200 for an
Mhm.
emergency room visit. If
Mhm.
you're admitted, that's waived. Okay.
Right.
Why? Well, because it's considered an emergency.
Mhm.
Okay. It generally is going to be a, a life-threatening scenario there.
Right.
Now, urgent care has started to pick up where a lot of the folks who would go to an emergency room
Okay.
before,
Mhm.
they would go for colds and flus and stomach aches and things like that. Where, yes, is that important? Yes, it's important. We are still in the throes of a pandemic, if I need not remind everyone. So, long story short, urgent care, a lot of the insurance plans, and this is
Mhm.
where Pennie is also very helpful through pennie.com, through our call center, through working with local brokers and assisters. Everyone can connect with the plan that best serves their needs. So,
Mhm.
if having access to an urgent care facility is important, we want to make sure that we take a look at the particular plan and make sure that that's an option with that plan for you. Because let's face it, and I've been there.
Right.
I've lived in an area where, when I lived in Baltimore, there was an urgent care that was literally a stone's throw and a light breeze from my apartment.
Mhm.
It was closer for me to get to there than it was to get
To
to
the
Johns
emergency.
Hopkins.
Mhm.
So why wouldn't I go?
Okay.
So, to my point and to your question, the various plan options available through Pennie will provide you in clear description right through pennie.com through our plan comparison tool.
Okay.
Again, just click on Get Covered. Um, you will be able to take a look at our plans. You'll be able to see what the deductibles, the copays, out of pocket maximums, what those would look like. But more importantly, if you would have access to an urgent care. So it's important to go over that information. Hence the reason I say 844-844-8040. Call Pennie. Our customer service reps can work with you right over the phone. If you don't like to work over the phone, because, well, sometimes people don't like to talk on the phone, we get that. You
Okay.
can chat with them live through pennie.com. So you can
Oh,
use
okay.
the
You
chat,
just
yeah, you can use a chat feature on your mobile device or through your computer to talk with one of our customer service representatives and get that information now. But here's the thing, and I know this better than most. Not everybody likes to talk on the phone. Not everybody has access
sure.
to a mobile device, and not everybody has access to broadband. Okay. Where I
Mhm.
live, you go from 5G to 4G to OG real quick. No, and it's the truth. It's the truth. So, from my perspective, I understand
Mhm.
that being able to connect with local resources
Mhm.
matters. Again, through pennie.com, you can go right to the bottom of pennie.com and connect with a local assister or a local broker
Mhm.
just by putting in your zip code, just by
Okay.
putting in your zip code and searching. Okay.
Okay.
Yeah, it is very, very easy. And here's the thing, if you're in a position where, again, you've got access to a phone, but you don't have access to a computer,
Yeah.
and you would like to talk to a local Pennie certified broker or Pennie certified assister, you can call 844-844-8040, and one of our customer service representatives can help you connect with a broker or an assister in your area right over the phone.
Well, I mean, say that again. 844-8.
8 844-844-8040.
Okay. 040.
Yeah, 8040.
Okay. Um. Uh. Okay. Let's go back to the options.
Sure.
Uh. Now, is one required to select medical doctors, pharmacies within the Pennies network, or could they select outside, right? But then pay an additional um, fee?
And that's a great question. And it goes back to why we have a competitive marketplace here at Penny.
Mm-hmm.
Okay. Underneath each of the insurance carriers that we have here at Pennsylvania, and when I say insurance carrier, I mean insurance company.
Right.
Okay.
Mm-hmm. Mm-hmm.
And our companies are companies you'll know.
Mm-hmm.
Believe me, we partner with the biggest
Mm-hmm.
insurance companies here in the Pennsylvania market.
Okay.
But here's where choice comes into play. Okay. Under each of those health insurance companies, at Penny, you have different insurance options that are available to you. What do I mean by that? Well,
Mm-hmm.
there are different plan options. Okay. There's what's known as an HMO, Health
Mm-hmm.
Management Organization, an EPO, an exclusive provider organization, and a PPO, preferred provider organization.
Right.
Now, again, if I made a lot of people's heads blow up right there, I am with you, okay? Because when you start getting into EPO, HMO, all that stuff, people generally glaze over and you've lost them. But um, you have those options. Now, to your question specifically,
Mm-hmm.
what option would be the best option for someone who would want to go or have the ability to go outside of their network? Well, an HMO is typically the type of health insurance plan where you have to have a primary care provider. In other words,
Right.
what's unique about that is a primary care provider is one that can help you coordinate all of your care, which is great, always beneficial to have someone help you with that.
Mm-hmm.
And and as long as you're within network, it's incredibly affordable with regard to not only your health care but prescriptions, et cetera, et cetera. So HMOs, I've always been. I grew up in Southern California, so we had HMOs before Love Was a Battlefield. And if you know that song, Robin, don't laugh, don't laugh. um, but we had HMOs a long time ago. Now, an EPO is an exclusive provider
Hmm.
uh, organization, which again is very akin to an HMO in that you are in network and things are affordable.
Right. Okay.
Now, a preferred provider organization gives you the ability to say, okay, I'm in network. And as long as you're in network, things are good. You do not have to have a primary care physician. You can pretty much see any in network doctor,
That you.
physician you want.
Mm-hmm.
Okay. Now, you also have the ability to go out of network. Now, that's going to cost you a little bit more,
Right.
but you have the option. Now, you also have that option with HMOs.
Mm-hmm.
Again, it might cost you a little bit more. So
Right.
it's always important that you know what your options are. And here's what's really going to kick you is not only do we have various insurance companies, various insurance plans, but we also have three different metal tiers at Penny. We have bronze, silver, and gold. And it's funny because depending upon your unique scenario, your situation, the situation of your family, the needs of your family, you might find that a silver plan at Penny with a particular insurance company, with an HMO, EPO, PPO,
Mm-hmm.
whatever the option would be, is a far more affordable and protective scenario for you than your neighbor who may have opted for a gold plan.
Mm-hmm.
So it always pays. And this is the one thing that I cannot stress enough. With Penny, it is not about connecting with your health insurance, your dental insurance, and then, doing the Ron Popeil thing and setting it and forgetting it. Um, we're not meant to be set and forgotten.
Mhm.
We have a competitive marketplace. Our marketplace is dynamic, just like the people in our Commonwealth.
Mhm.
People today who are working 2 and 3 jobs to make ends meet
Mhm.
don't have access to financial assistance, or not financial assistance, but to employer care. They
Mhm.
can come to Penny, have access to financial assistance, and then a year from now be in a position where they say, you know what? I'm going to hang my own shingle. I'm going to start my own business, and I will be a sole proprietor. I will create my own company. Penny's going to be there to help all along that continuum. Okay.
So, using that scenario,
Yep.
I start my own business now, right?
Hmm. Yep.
Um, but I have no employees.
Yep.
I still can remain on Penny's insurance. I can still remain with Penny.
Yes.
Okay,
Yes.
I have a question for you. I I have Penny, right?
Hmm. Hmm.
I'm insured, have health insurance through Penny.
Yep.
I land a job, and the
Hmm.
job offers health insurance.
Yep.
Am I automatically, will I have to notify Penny and I'm automatically dropped because now I have health insurance with my um, employer?
Yep. If your offer of employer insurance is affordable, then yes, at that point, and this is important, you want to make sure that that coverage starts before you contact Penny and say, hey, guess what? My employer coverage starts on July 12th. Contact us and make sure that we know that that employer coverage starts so that you can continue with that.
What if it's more feasible, economically feasible, looking at my budget, that
Mhm.
um, Penny
Yep.
fits within my budget and not what my employer offers? So can
If
I?
it is determined, no, and Robin, that's a very good question, but it's not an uncomplicated question in that there is actually a standard that we utilize to determine whether or not that offer of employer sponsored coverage is affordable. Okay.
Okay,
Um, when
you
you
all
have
make that. You all make that decision, not me, because
Right,
right. Is that
right.
what you're saying? You
Well,
make that
and the thing is, Robin, is 9 times out of 10, that decision is, you know, it's one that a Penny certified broker, that our sisters, that our folks through the contact center can help
decision.
in terms of calculation and determining what that is. Generally speaking, the employer is the one, believe it or not, the employer will be the one that, has the information,
Oh.
salary wise, percentage
Mhm,
wise,
mhm,
etc.,
mhm,
that helps determine whether or not that offer of coverage is indeed affordable.
mhm,
If it's found that the coverage is not affordable, um, and you opt to shop on the individual marketplace,
mhm.
absolutely, that's an
Okay.
option for you.
Okay.
But here's a more common scenario that back in late 22, just the year that we're coming out of, um, there was a scenario that was pretty common where if you had an individual who had a significant other, and in many cases dependents,
Mhm,
and the individual had health insurance through an employer, but when they brought on their significant other and their
mhm,
dependents, the
mhm,
cost of that insurance went through the roof
mhm,
and now became cost prohibitive for the family.
mhm,
um, Up until very, very recently, like I said, I think it was September or October of 22. um, the legislation was finally was finally righted. It was corrected. You may have heard in the past, and truthfully, this is only something that insurance geeks would talk about. You would hear about the family glitch. Well, the
Mm-hmm.
family glitch was an interpretation by the Internal Revenue Service of the application of advanced premium tax credits, financial assistance, that basically deemed if affordable coverage was available to the individual and the family, then regardless of what it costs, it's affordable. Uh, no. So now an option is you can have a family member who is protected under their employer if adding the family, significant other,
Mm-hmm.
dependents to that would increase the level of insurance and make it cost prohibitive. The significant other and the dependents can seek other options through Pennie, through CHIP,
Okay. Okay.
etc. So now there's another option available for people to help them get protected. And I'll be quite honest with you, you've probably never seen me river dance, but I was river dancing that day.
Here we go.
Yeah, how about it? How about it? All right.
So is that something similar? And because I want to make sure I'm following you. I have Penny. I'm gonna use myself as an example. I have Penny.
Mhm.
I now get married.
Mhm.
My spouse, his job offers he has health insurance, right?
Right.
Um, my child has CHIP.
Okay.
Okay,
Yep.
so now dun 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 dun, dun we get married,
Yep.
right? So what we still have these options. I can remain with Penny. My child can remain with Chip, and
Correct.
he
And
can.
have his employer coverage. So again, now here's the thing. You can remain with Chip if being added, remember what I said before, being added to your significant other's
Help.
employer coverage becomes cost prohibitive,
Right,
unaffordable, and
right.
there is a benchmark for that, by the way,
Okay, okay,
becomes cost prohibitive to your family. And again, that's a very quick calculation that can be done, and a determination can be made whether or not you can remain on Penny.
okay,
And now another factor in there is, you know, if it is affordable, then depending upon the household income, yes, your child can either remain on CHIP, premium free, or with premium. Still a great option for kids. Um, there are a whole lot of scenarios that can play out there, but
okay.
the important thing to keep in mind is you know, and this is something that I might not have touched on before, but it's incredibly important about Penny. Okay. Um, as a state agency here in Pennsylvania, we have a very, very close relationship with our friends over in the Department of Human Services.
I was about to ask. Yep. Mhm.
Penny actually operates a no wrong door policy. Okay. Um, we recognize not everybody is going to be well versed in health insurance.
Mhm.
Hardly any of us are.
Mhm.
We recognize the fact that not everybody is going to be well versed in medical assistance, in CHIP, in their options, or Medicare.
Mhm.
So if you call the 844 number, you talk to someone at Penny's call center, it's determined that you may be eligible for medical assistance.
Right.
Penny actually has a warm transfer process.
Hmm.
We can transfer not only you and your family, but we can transfer your application data so that you don't have to reinvent the wheel when you talk to the folks at medical assistance. Now, the vice versa is true.
Mhm.
So Penny refers individuals and families to medical assistance and CHIP, and medical assistance refers individuals and families back to Pennie.
Mhm.
So there's a lot to be said for that. Now, one last point on that no wrong door policy and where it's really going to come into play as something significant for all of us. You heard me mention before, Robin, that there are currently 607,000 uninsured in Pennsylvania.
Mhm.
Right now, all of us, and we all need to be thankful for that. We're here now.
Mhm.
We
Mhm.
made it. We made it through the pandemic
Mhm.
so far. I'm knocking on wood. So, um, but long story short, there are many of our friends and neighbors in Pennsylvania who have been protected under the public health emergency and continuous coverage through
Mhm.
medical assistance. They've been protected through medical assistance, 2020, 2021, 2022, for good reason. We needed to make sure folks were safe,
What
families were healthy, and that they were whole. Um, but the continuous coverage is set to unwind. It was actually part of, uh, over the holidays, there was an omnibus bill that passed. They always do it over the holiday, but there was an omnibus bill that
Mhm.
and there were a lot of good things to come out of that. But
Mhm.
one of the things that we're all going to have to prepare for is that right now there's about 500,000 across the Commonwealth of Pennsylvania. There's about 500,000 of our friends who are currently protected under medical assistance, who, as of April 1st, the Department of Human Services is going to start. Now, mind you, this is going to be a year-long process. This isn't going
Mhm.
to be April 1st, then, well, guess what? You don't have coverage. No, that's not going to happen.
April Fool.
Yeah. Oh, yeah. How about it? Well, that's what I keep on telling folks. April Fool's this year is not going to be no joke.
No.
It's going to be a very serious time for a lot of us because, again, Pennie is so very new.
Mhm.
There are a lot of people who don't. If you say Pennie to some folks, eh, they're going to think Big Bang Theory,
Mhm.
Pennie, or
Mhm.
something. They're going to think what you thought,
Mhm.
Robin, when you thought about
Yeah.
extra pocket change or something. They're not going to think about us as a pathway to protection, as a
Mhm.
pathway to maintain their quality of life. And truthfully, um, this unwinding of continuous coverage is going to be a significant event for all of us. The good news is that since February
Mhm.
of 2022, Pennie and the Department of Human Services, as well as so very many of our community partners, from hospitals to health centers to legislators and nonprofits, faith-based groups, we've been spreading the message and
Mhm.
raising the awareness about the importance of recognizing that any time of year, if an individual, if a family have a notification that says, unfortunately, you don't qualify for medical assistance any time of year, that is one of those qualifying life
I was
events that
like,
we talk. Yes, ma'am. Yes,
mhm.
ma'am. That is
Mhm.
one of those qualifying life events where they can come to Pennie. They can learn about financial assistance. They can learn about their plan options. They can
Mhm.
secure health and dental. So,
So I want to repeat that because that is a, along with what you were sharing earlier, but that's something we really need to um, raise awareness
yes, ma'am.
come April 1st. Now it's going, as you said, it's going to take some time. It's a
Right.
process,
Yeah.
but 500,000
That's a lot of
folks,
that's a lot of people.
that's
Yeah.
a lot of people will now begin to, I would say, wean off of, will be cut off
Right.
of medical insurance, right?
Yeah. Medical
Medicaid,
assistance. Yeah. Yeah.
yeah,
Medicaid. Yeah.
Medicaid.
Hmm.
Um, as I understood, it basically was just temporary because
Right.
of the whole pandemic, the COVID, and
Yes.
now the time has come where those 500,000 plus now will be removed,
Right.
and this is the perfect time, a great time
Yeah.
to reach out, even in advance, even if you didn't get the letter, but at least you want to have some awareness and talk to someone from
Yep.
Pennie,
Yep.
and learn and understand what your options are should you get that. And more than likely, it's, well, 500,000, you could be one of them, right?
Yeah.
To receive that letter, at least you are prepared. At least you have the knowledge. At least you have already been in contact with Pennie. And so that helps reduce the stress, families panicking, individuals panicking, right?
Mm-hmm.
Because now they have, as the word I kept hearing you say, is they have options.
Yep.
Here's your options. For those who are watching now, I'll be watching later. If you or you know someone, I'm quite sure you do know someone who um, had right now you have Medicaid. You know, you fell into, you qualify, especially during the pandemic, right? Because
Mhm.
of course, being the kind-hearted Americans we are, we did not want anyone to go without insurance, especially during that time, right?
Oh.
And but there is a time limit, a deadline. And so we want to make sure that if it's not you, or if it's not, yeah, you who just tuned in, or you who've been on here for some time, right? If it's not you, I guarantee you it's someone who you know, and more than likely, someone in your family, someone who lives next door to you, right? Someone who you're caring for.
Mhm.
So it's so important for you to contact Pennie, right? Get all the information that you can get, right? Pick their brains. Keep calling back if you have to, right? They don't mind.
Why we're here.
Yes. But listen, for those again who are watching now, real time, and those who will be watching tomorrow, the next day, the next day, and next day, you know, this is great information, good information. Many of you who've watched many of our Facebook lives, I always mention we are here to empower, to inspire, and to offer hope, right? And even though the name of our organization is Celebrating Sisterhood, oh man, I hope you are listening too. Now we're celebrating sisterhood and brotherhood, right? We want you all to get this information. Again, I'm just blessed to have with us today Frank Yeager. Now, my new friend that I'm going to put on my speed dial. I'm going to write your name on the bathroom wall.
That's all, hey, that's all good. That's all good. And believe it or not, Robin, that's probably not the first time that's happened. Yeah.
But listen, all of you out there, you guys have to, you may not, when you dial that number, I can't guarantee, as a matter of fact, I'm quite sure you won't get Scott on the phone, but you will get
Oh,
someone.
you'll get individuals who are far more intelligent than myself. I promise you that. Like I said before, I'm I'm all right, but wow, we have our customer service folks are phenomenal. And if you ever really want to have your mind blown, sit down with one of our assisters in the Philadelphia area or one of our brokers in the Philadelphia area. Um,
Now, how
you
can they
really,
find them? How can
oh,
they
that's
reach?
again, that's
Go
real
to
easy.
Pennie. Mhm.
You can call 844-844-8040 and just tell the customer service agent, hey,
In
you know,
Philadelphia
I live
area,
in Philadelphia. I
Harrisburg.
live in southeastern PA. I want to connect with an assister or a broker in my local community. And you'll be surprised.
Okay.
You will be surprised how many we have throughout southeastern Pennsylvania. And to be quite honest with you, most of you probably know them as
Hmm.
they're people that you see in your neighborhood.
Hmm.
So it's really, really easy to connect. You can also just go to pennie.com and right from our homepage. If you go over in the top, you'll see where it says support. If you click there, you'll see where it says connect, and you can click on connect, and you from there you can chat with customer service, you can call them, you can connect with a broker or a sister. All we need is a zip code. That's it.
Great. We're winding down.
Mhm,
Um, and you said something, and I'm just going to end on a lighter note. But before I do, because I did have another question.
mhm,
Oh,
mhm.
it's Penn. It's a state agency. Do you fall under the Department of Health and Human Services or Department of Insurance or
Actually,
neither?
we're separate. Yeah. Penny is the way our legislation was set up.
Mm-hmm.
Penny is a state agency, but we're not under the governor's jurisdiction. Now, if you think about that for a second, the folks that penned our legislation and who structured our organization that way, they were pretty brilliant. And I'm like I said, there are a lot of people here at Penny that are far more brilliant than me. But the folks who, and I worked on the launch team for Penny,
Okay.
but even before that, the policymakers, the legislators in Harrisburg and throughout the Commonwealth that got together and actually envisioned this exchange and how it was set up. Um, they really did so much
Uh,
for us, all of us.
mm-hmm.
Because you might not need Penny now,
Mm-hmm.
but
Yeah.
a year from now, 5 years
Mhm.
from now, you might, or your daughter might,
Mhm.
or your neighbor. We'll be here to help. So that again, that's a really good question, Robert.
Yeah. Well, I want to thank you, Scott, and your team. Diana, who of course is not on here, and Jennifer, those who I've been in communication with to schedule this Facebook Live. I appreciate you all for you know coming on and saying yes, and let's get this information out. I'm quite sure, again, our audience have been well informed. Um, and so I'm really excited about the future in terms of folks being covered, you
Mhm,
know, getting health insurance. Um, and I'll end on this note. You just mentioned not too long ago about, we're in the neighborhood,
mhm.
you're just calling the neighborhood. And what came to mind, and those who know me, right, they know that Robin has a sense of humor. Corny, but not a sense of humor. And I'm an extrovert, as you probably could tell. And when you said that, what came to mind, and I know I'm going to date myself, right? I thought about it's either Sesame Street or Mr. Rogers. And I said, when I'm gonna call, these type of Facebook lives. Remember the song, Who Are the People in Your Neighborhood? In your neighborhood, in your neighborhood. I'm gonna use that, right?
I
These
don't
are
blame you.
yeah,
That
these are the people in our neighborhood. Let's meet them. Let's greet them. Let's connect with them. I
yeah.
really like that. Someone said great information shared. Thanks a lot.
Oh, I can't thank again. Robin, thank you. And everyone, thank you for the privilege of your time this evening. I know we sort of took a little deeper dive than most might have thought, or
that's fine.
you might be having more questions. If you do, don't hesitate to contact us. We'll be here to help.
I'm gonna send them to you.
And yeah, thank you so very much.
Thank you again. Thank you all who are watching now and those who will be watching in the near future, perhaps tomorrow, the next day, next day. Hey, yeah, turn off, Housewives of Atlanta or LA and watch this, right? I'm quite sure you will benefit more, right? But whatever you do, please share
Yeah.
this Facebook Live with those, your contacts. And again, if you have any questions, you can you can call 844-844-8040. A lot of eights, a lot of fours, and two zeros. Wow. Okay. So thanks again. Thank you so much for joining me, and I appreciate it. And we'll be in touch. And I'm quite sure this is not the last.
All right. Well,
I
thank you.
promise you that.
Everyone be safe, please.
Okay. Have a great day, everyone. Thanks to our producer, Ken. Thank you so much. Okay. Take care. Bye bye.